Hello, and welcome to the Illinois Public Risk Fund Video Series 202, Injury, Accident Investigation, and Claims Reporting. My name is Robert Buse, and I am the Executive Director for the Illinois Public Risk Fund. And I will be presenting you with an overview of IPRF and what you need to do when a work-related injury accident occurs, along with the respective forms that need to be submitted to IPRF Claims Division. We know that all of you are very busy, and we appreciate you taking the time out of your schedule to view this important information video to learn more about IPRF, injury accident investigations, and claim reporting. We promise you that you will not be disappointed with the information that will be disseminated in our presentation. In Series 201, we provide you with an overview of the IPRF Claims Division and the IPRF website, your resource center. I would recommend that you take the time to view that webinar to gain an understanding of the many resources that are available to you. In this Series 202, we provide you with an overview of IPRF website, your resource center, IPRF Injury Accident Investigation Procedures, and IPRF Claims Reporting. We hope that the information provided to you in this video is informative and helpful, especially when a work-related injury occurs and resources are needed. I first want to begin by providing you with a brief overview of the Illinois Public Risk Fund and our services that we provide to all our member agencies. The Illinois Public Risk Fund was established in 1985 and was created as an intergovernmental, non-for-profit pool. Currently, we are the largest monoline workers' compensation pool in Illinois, and we write over 700 members. Let's now move on to our second topic item, the IPRF website, and review the resources that are available to our member agencies. The IPRF website is designed to provide the information and tools that our members need to document, report, and file a claim. Our site provides many great features and is organized to help you find general and specific information quickly. The home page was designed with the objective of giving our members an easy-to-find content layout and quick access to find resources and documents that they may need. For now, I want to draw your attention to the IPRF claims section of the home page. I will be discussing the employer link and the documents and forms link as well. Both link or pages provide you with a step-by-step guide along with the documents and reports needed to handle a work-related accident or injury. So, our focus today will be to explain each page and the resources that are available to you when a work-related injury or accident occurs. But before we do, or I do, I want to inform you of your role and responsibility as the employer when a work-related injury accident occurs. In Illinois, the Workers' Compensation Act provides that accidents that arise out of and during employment are eligible to receive worker compensation benefits. This generally means that the Act covers injuries that result in whole or in part from the employee's work. Well, what is an accident? An accident is an unplanned, unwanted, but controllable event that disrupts the work process and causes injury to people. Employers and/or supervisors often think that they have completed their investigation of the injury and accident when they have finished filling out or completing the state-required Employer's First Report of Injury, Form 45. The information on Form 45 is a good start to investigating a new injury claim, but it is not by far the only information that needs to be developed when investigating an injury claim. An injury accident investigation is a workers' compensation investigation to determine the facts surrounding an alleged injury to the employee while they were on the job. The term investigation is one of such breadth as to encompass all methods, procedures, and situations having to do with securing the information necessary to help process the workers' compensation claim. The purpose of the investigation is to establish whether the employee's alleged injury was work-related and happened in the course and scope of employment, or whether the injury was non-industrial or affected by third parties. Why investigate? Well, number one, prevent future incidents, especially leading to the accident. Number two, identify and eliminate hazards. 3, expose deficiencies in process and/or equipment. 4, reduce injury and worker compensation costs. 5, maintain worker morale. And 6, meet Illinois OSHA rule requirements that you investigate serious accidents. In the early stages of a workers' compensation claim, a thorough investigation is crucial to determine and document injury-related accidents, the facts before evidence gets lost or memories deteriorate. So, employers or supervisors need to apply the who, what, where, and why of every injury accident by documenting who was present, what activities were occurring, what happened, where and what time, and why did it happen. It is important to document the claimant's alleged reported injury, along with statements by any witnesses prior to possible coaching by third-party worker compensation attorneys. So to assist our members in their efforts to properly investigate and document an injury accident, IPRF has created several resource links to assist the injury accident investigation team. The employer link and respective page was created to assist our members with a step-by-step guide to handling a work-related injury accident investigation. We all know that when an injury or accident occurs, especially a critical event, that the stress of the event may cause us to lose focus on the steps that need to be taken to handle or mitigate the incident. So let's open that page. Located on this page is a simple 4-step guide that will assist the employer or the immediate supervisor through a work-related injury accident, along with the reports and forms that need to be submitted to the IPRF Claims Division. The convenience of this link is that anyone can access information via a smartphone or a web-accessible device to help them recall the steps that need to be taken when an injury or accident occurs. This is especially helpful if the injury or accident occurred off-site and you need a quick reference source. To assist you further, the injury accident steps exhibited on this page have been consolidated into a working document titled IPRF Injury Accident Toolkit, which can be downloaded and completed with fillable forms. It's a great resource, and I will introduce you to the toolkit later in this video. So let's look at the steps that need to be taken when a work-related injury occurs. Step 1 in the investigation, care for the injured worker. The safety and health of employees and visitors must be the primary concern when an injury accident occurs. Make sure the affected person gets immediate medical attention and take steps to provide for emergency rescue or evacuation as necessary. IPRF cannot emphasize enough the importance of rendering the care needed to the injured employee or employees. Please note that in step 1, that if a supervisor views this injury as serious or life-threatening, all efforts should be made to notify the IPRF claims specialist. By doing so, our catastrophic claims team can be activated to arrange any special medical care that may be needed for the injured employee. Further, the injury may require that Illinois OSHA be notified as well. The law in Illinois is very clear. For all public sector employees, Illinois OSHA is to be contacted for one of the following. All work-related fatalities must notify Illinois OSHA within 8 hours. All work-related inpatient hospitalizations, all amputations, and all losses of an eye within 24 hours. You can report to Illinois OSHA by calling Illinois OSHA's free and confidential number at 800-782-7860. The reporter must give the following information for each fatality or hospitalization incident. Number 1, the establishment name or organization name, the location of the incident, number 2. Number 3, the time of the incident. Number 4, the number of fatalities or hospitalized employees. Number 5, the names of any injured employees. And number 6, the reporter's contact person and his or her phone number. And finally, a brief description of the incident. Now, you don't have to remember these. They will assist you and ask these questions, but it's nice to know what you'll be asked at the time you make that call. In this entire 4-step process of conducting an injury accident investigation, no other step or action item will out-trump step 1, care for the injured employee or employees. Step 2 in the investigation, secure the injury accident scene. With medical providers caring for the injured employee, it is now our focus of securing the injury and accident scene. At this point, an assessment and a decision must be made to determine the severity of the injury and/or accident. In most cases, the injury accident scene may not reveal the mechanics of the injury. For example, we may have an employee who was working on a tool and accidentally struck their thumb with a hammer. In this type of scenario, not much of a scene investigation is needed. However, a more severe injury accident where a ladder had slipped out from underneath the employee warrants a thorough investigation, including securing the scene or injury site. Securing the scene should not be taken lightly, and doing so becomes even more important if the injury is severe, life-threatening, or catastrophic in nature, which demands for the securing of the scene, including contact with Illinois OSHA and the IPRF Claims Division. If the determination is made that securing the scene is not warranted, then at the very least, documenting the scene with photographs would be a safe and prudent action to take. Step 3 in the investigation. The responsibility of most supervisors is to conduct injury accident investigations for work-related injuries that occur under their watch. We provide the supervisor with the action items that need to be addressed to ensure a proper investigation of the injury accident. With the more important action items addressed in steps 1 and 2, we now can focus on gathering the information and facts to the event that occurred up to the occurrence of the injury accident. To help in gathering and documenting that information, IPRF has created 5 forms in our reports, all of which are one-page, simple to use, and are fillable forms. Let's begin to look at the employer's first reported injury, Form 45. It is important to note that the Illinois Workers' Compensation Act requires every employer to maintain records of work-related deaths, injuries, and illnesses. Form 45 requires the employer to list the details of what, when, and where the work-related injury took place. It's not an incredibly complicated form, yet many employers either fail to fill out the form or send it to IPRF in a timely manner. IPRF, on behalf of the employer, will then file the report with the Commission concerning such accidents arising out of and during employment. Special note, please do not give this form to the employee to complete. It is the supervisor's responsibility to address concerns, if any, surrounding the injury with the employee. Addressing safety and training concerns are critical in preventing injuries. The second form is the IPRF Injury Description Report Form 45A. IPRF Form 45A was created to help document the injury's location and affected body parts. The form helps us to document the area of injury, especially if the injury is a soft tissue type of injury. Further, the form will help us recall more of the specifics to the injury, especially if the supervisor needs this information later in time. The IPRF Form 45B is important and is not designed to find fault or blame. It is an analysis to determine the cause that can be controlled or eliminated. The purpose of this form is to try to answer these questions. How did the accident occur? Where did it happen? What materials, machines, equipment, or conditions were involved? Who was injured? And when did it happen? No investigation is complete unless corrective action can be taken, and with the information noted on this form, it is possible that a determination on what action should be taken can be identified. The fourth form is the IPRF Witness Form, Form 45D. Witnesses to the injury accident, such as employers, co-workers, and others who have had the opportunity to observe the injury accident, become important to documenting the misfortunate event. Getting statements from these witnesses as soon as possible is important because people may forget what they witness as time passes. The fifth form is the IPRF Questionable Claim Form 45E. IPRF members and local government officials are concerned about rising workers' compensation costs. For example, the State of Illinois Workers' Compensation Commission Fiscal Year 2016 Annual Report exhibits and reflects that the total workers' compensation benefit payments, the cost was approximately $59 million in year 2014. Remember that the Illinois Workers' Compensation Act is designed to compensate government and corporate workers injured on the job for lost wages, medical expenses, and any lasting disability, such as a partial or total loss of a body part, and rightfully so. However, IPRF and our member agencies need to vigorously fight claims we believe to be false. Hence the reason why IPRF has created Form 45E. If at any time an employer or supervisor has a reason to question a claim, IPRF needs to be informed and notified immediately. By completing Form 45E and submitting the form to IPRF, we can do our due diligence to investigate the claim to the fullest. When somebody gets hurt on a job and things are legitimate, we want to take care of them. If you're going to play a game or try to work the system, our goal is to try to nip that in the bud and keep our costs down. Step 4 in the investigation: meet with the injured employee. IPRF encourages contact between the supervisor and employee during absences resulting from an injury or illness. The type, frequency, and content of the contact will vary depending on many factors, including the type of claim and the prior relationship between the supervisor and employee. But we understand that most contacts with the injured employee during their absence does help to maintain a great relationship and, of course, morale with the workforce. The first form is the IPRF Employee Injury Accident Report. Now, this form needs to be completed by the injured employee as soon as possible. Employees shall use this form to report all work-related injuries, illnesses, or near misses. These are events that could have caused an injury or illness, no matter how minor. By doing so, the information will help your organization to identify and correct hazards before they cause serious injuries. This form shall be completed by employees as soon as possible and given to a supervisor for further action. The second form is the IPRF Medical Authorization Release Form 45F. The Illinois Workers' Compensation and Occupational Disease Act provides that every hospital, physician, surgeon, or other person rendering treatment or services in accordance with the provision of this section shall, upon written request, furnish full and complete reports thereof to and permit their records to be copied by the employer or insurance carrier. So, the purpose of this form, Form 45F, is to give permission for the physicians and/or medical group to release the injured worker's medical information to facilitate the evaluation of the injured worker's claim for workers' compensation benefits, and number 2, permit said disclosure information to be admitted into evidence at a hearing regarding the claim for said benefits pursuant to the appropriate rules of practice before the Illinois Workers' Compensation Commission. For these two reasons, it is important that the supervisor obtains the authorization form from the injured worker as soon as possible. And finally, and just as important, the employer and immediate supervisor have an important role in the injured employee's recovery and return to work. Stay in touch. Simple, genuine gestures of employer concerns make the worker feel valued and speed the recovery process. So that completes our review of the 4-step guide for investigating a work-related injury or accident. Remember that this information can be easily obtained in the field or at your desk by simply clicking on the IPRF website and tagging the employer link. I now want to show you where to obtain and download all the forms that we reviewed within the 4-step process. Back on the IPRF homepage, all the documents and forms that were discussed in our 4-step guide can be found by clicking on the link titled Documents and Resources. So let's do just that to review what is available to you on this page. The Document Resource page is basically your resource center for all forms and reports that you, the employer, would need in the administration, management, or investigation of a workers' compensation claim. All of the forms are downloadable and are PDF forms, so you can easily complete the form, save it, and then disseminate as you deem appropriate. But I want to draw your attention to the documents relevant to our topic today. The IPRF Toolkit. Working with our claims and loss control divisions, IPRF has developed the IPRF Injury Accident Investigation Toolkit that will assist our members with the necessary steps that need to be taken when an injury accident occurs. The kit includes a simple to follow injury accident investigation guideline, along with the forms and reports that need to be completed to ensure a successful outcome for both the injured worker and the member agency. Make the Injury Accident Investigation Toolkit a go-to kit in your supervisor's toolbox of resources. Let us now look at the left side of the IPRF claims section that is titled ICE. ICE is an acronym for Internet Claims Edge. ICE is a powerful, complete, and easy-to-use risk management information system that provides you with a near real-time data access for detailed claims information and data views. The system also provides you with access to historical point-in-time data for reporting and analytics. Within ICE, you have both a comprehensive overview as well as a complete claim detail informational screen. Whenever and wherever you need it, view historical claims data at a glance or run reports based on standard templates or customize your own. It's a great tool, especially to have when you need current information regarding your claims. To help you better understand how ICE works, we have a standalone video introducing you to ICE and how to navigate through the system. To bring this session to a close, I need to explain the importance of submitting your claims in a timely manner. Workers' compensation was designed to protect America's workforce and employers. Perhaps at no time is this more important than immediately following a workplace injury. The first 24 hours following an injury sets the pace, tone, direction, and progression of the claim and impacts end results. Developing and implementing consistent internal practices, policies, and procedures before an injury occurs and training your employees in those processes saves time and money after an injury occurs. Prompt reporting also decreases the risk of fraud, litigation, fines, or penalties. Late reporting increases claim cost, destroys credibility, and affects claim resolutions. Now, to notify or submit your claim, you will see on your screen 5 methods by which your claims or reports can be submitted to the IPRF Claims Division. This information is also located within the IPRF Toolkit for Injury Accident Investigations. So this brings our instructional and educational Series 202 to a close. We hope from the information gained in this session that your agency and respective staff will know where to locate the injury accident guidelines and the respective resources needed to conduct a successful investigation. We are excited that you have taken the time to view this video, and we thank you as well for your continued support. To ensure that we are addressing the topics that are most important to you, we welcome your feedback and suggestions. Feel free to contact me at any time at my information or contact information exhibited below. Thank you and have a great day.